All right. Welcome to the Pathogen Lounge. I have a very special guest this evening, Dr. Cole Hackett, who is currently in Florida. Tell me about the program that you're in.
It is the University of Florida's AEGD program, but it's actually in Clearwater.
Okay.
Clearwater area, yeah.
Very, very good. So I'm extremely proud of a couple of things. Cole is one of the principals in the Life and Dentistry podcast, and I was there at the birthing of the Life and Dentistry podcast a year ago at Voices of Dentistry. So before we get into the 2 minutes with Tom, I want to talk a little bit about that. I'm so proud of you guys. You guys are actually presenting at Voices. That's a tremendous honor. You're a top 15 podcast in the world to be able to do that. So, and then in March, Life and Dentistry Conference number 2, which I am honored to participate in, and I'll let you talk about that. But first, Voices. Tell me what you're doing at Voices.
Yeah, so at Voices, we have a little talk. We're going to, obviously we're brand new dentists. We can't get up there and talk about how to do dentistry better than anybody else. But one of the things we feel like we do kind of have a connection with is just being good people, connecting with the people around us and other people within dentistry. So we're going to get up there and just talk about what we're doing, how to be great friends, how to be great dentists, and just be there for each other, and hopefully people will get something out of it.
Yeah, they will for sure. You guys have done an extraordinary job of networking, and finding mentors, because that was my message back when you were a student at the University of Kentucky. It's just find good, solid mentors, and Voices just kind of opened up the whole world to you. And I'm just really proud on how you've kind of taken it and run with it. So the Life and Dentistry Conference is a one-day event that's going to be here in Lexington. I think it'll be the biggest CE event ever in this area. Very cool event. So tell me about the lineup for that event too.
Yeah, we have an awesome lineup. Basically, our theme this year is Living Your Epic Life, and we actually got that from Dr. Maloli at Voices last year.
Yeah.
And, his big thing is living your epic life. And I asked him for permission for us to use that as our theme.
Nice.
And he said, yeah, go for it. So, it's going to be about dentists that are out there living their epic lives, not only in dentistry, but in life in general. So we've got Mark Costas, Justin Moody, Tiger Safarov, Bruce Baird, the Malolis, and last but not least, Tom Larkin, who's been there with us from the beginning. And
living the epic Lexington life.
Yeah.
Bourbon, basketball, horse racing. That's why I'm here.
Yeah, that's right. That's right.
Okay, so let me tell you an extremely proud moment. This is about a month after you graduated. I'm listening to your podcast. I love your podcast. One of the things I love, and I kind of advised you guys, was kind of talk about your journey through that first year. It's very compelling. I mean, if I was in dental school or a young dentist, I would just be glued to your podcast. And so I'm listening to you, and you made a 2 or 3 minute reference to a patient that you saw, and it really kind of blew me away. I was very, very flattered. You made reference to myself and to Dr. Baird. But the thing that I don't understand is why you guys really get it, because obviously the residents that saw the patient that you saw have had similar type training, but what is it about you guys? I've had some influence on you, but you really seem to have gotten the message about the oral systemic connection. So tell the story about that patient.
Yeah. Well, for me personally, I think it's been a little easier for me for the oral systemic connection to happen because when I was young, I took pre-medication. I was born with heart defect.
Gotcha.
And so for me, I remember from day one going to the dentist and having to take a medication before I could go to the dentist.
Right.
And so that's always been a way for me to click in my mind of a connection between the health of your body and the health of your mouth.
Perfect.
But then also just watching people like you, Dr. Baird, talk about these things, and you have been successful dentists yourselves, and say, you know what, these people have done it. They know what they're doing. There's something to this.
Right.
So then after hearing you all talk about these things, I said, well, I'm going to this residency. I'm going to try to implement it and start practicing talking to patients in this way. So one of my first patients I had seen, I looked at previous chart notes, and a couple previous residents had said to this patient, you know, you need a couple of teeth extracted, you need deep cleanings, and he never did go through with it. And by the time I saw him, I mean, these teeth were class 3 mobility. He had been wanting these things just splinted all together. So what I did, another thing that you all are big on, is connecting with the patient one-on-one, finding something to relate together on,
right,
and then go from there. And then also, you know, in your book, the I'm Free book, you talk about making things simple, something for the patient to connect with. So there was kind of that start to it, and then completing my exam, and then I sat the patient back up and said, you know, I'm going to have an honest conversation with you. I said, you have a history of heart trouble. You have a pacemaker. You've had a heart attack before. I'm telling you, there is a huge connection between the health of your mouth and the health of your body, and specifically the health of your heart.
right.
And I said, I know there have been past residents that have suggested to you to get some certain treatments done, and you haven't wanted to do it. And I'm just letting you know that what's going on in your mouth has a direct correlation with what's going on in your heart. And I said, I'd love to help you out with this. And if you want, we can start today. And he said, I have never had somebody talk to me about my teeth connected with my body. He said, my heart has always been a concern of mine since I've had this treatment done. He said, I'm ready to go right now. And by the next appointment, he had signed an $8,000 treatment plan.
Wow. Wow. It just gives me chill bumps. You know, I mean, you know, because that's why I'm doing what I'm doing, you know, to have an influence. I always say that the greatest honor is to have an influence on a young dentist.
Yeah.
And when you told that story, I was like, you know, I was just kind of flabbergasted. So I thank you for relaying that story. I'm, you know, I just can't tell you how proud I am of you guys. I can't wait to see you in Scottsdale, and then we're gonna burn the town down. And when you get to Lexington.
Yeah, we're excited, and thanks for everything you're doing. I mean, all of this is, you know, we're listening to what you're doing, and you've been a big mentor for us. So we appreciate everything you're doing too, and we're excited to have you at the conference.
Very good. Thank you so much.